Now, Wellness Wednesday on Fox 54 News, sponsored by Regenesis.
Burns, they can happen easily and are often painful, but they're also something that need to be treated quickly. Fox 54 Kenesha D hears from experts about how you can be ahead of the curve and avoid some misleading ointments. We learn more on this Wellness Wednesday.
When a burn happens, it can be quick and startling, but treating it right away is crucial. Ronnie and Anna with One Source Preparedness showed Fox 54 how you can quickly address a burn.
If Anna got burned right here on her arm, then we would immediately take some clean water and just rinse the area, okay? You want to make sure that it's rinsing for maybe about 10 to 20 minutes, especially it's going to help with that pain. And like you said, it's also going to stop any further damage to the tissue. Clean, non-stick, sterile dressing, and then just not tightly because you don't want it to be so tight to where you cut off the circulation in the limb, but you want to just lightly wrap it, okay? And again, you're just wrapping it after you rinse it to keep it dry and clean.
And depending on the burn, you might need to go to a medical professional. Aaron White, a burn surgeon with UAB, told us it might actually be good if you feel the pain.
I get patients who come in with a bright red wound and they say it really, really hurts. And I tell them, like, that's a good sign. That means that it's pretty superficial and your nerves are okay and it will probably heal with a little bit of good wound care. But when it's insensate, when it doesn't feel like anything, that's usually a deeper burn. It's going to need some help.
For parents with children who might have been burned, Sue Rowe, charge nurse for Children's of Alabama Burn Unit, says it's important for blisters to stay intact.
If there's a blister, you want to leave it on there unless it pops. Your skin is your friend, so you want to keep things clean and intact. But if it's a big blister, it may pop by itself. If the area is open like that, then an antibiotic ointment and some kind of a light covering is helpful for it.
When it comes to burns, there are some old wives' tales, such as using butter as an ointment. It's something we're told you shouldn't do.
Don't use butter. It's actually a grease, and it can make your burn deeper, hotter, because it holds the heat in.
Toothpaste is another common one, but it's really abrasive. It dries out the skin. The only home remedy that I can recommend is aloe. Unscented aloe vera is very good for superficial burns.
With your Wellness Wednesday, I'm Kenesha Dees.
And if you want to hear more from the experts, we have extended interviews right here on Fox 54 Plus.